Infertility and building families. Infertility. When a couple has failed to conceive a child in a year, they receive the diagnosis of infertility. Infertility affects about 10 to 15% of couples in the United States. Male factors create infertility in about a third of the cases. For men, the most common cause is a lack of sperm production or low sperm production. Female factors cause infertility in another third of cases. For women, one of the most common causes of infertility is the failure to ovulate. Another cause of infertility in women is pelvic inflammatory disease, PID, which is an infection of a woman's reproductive organs. Both male and female factors contribute to the remainder of cases of infertility. Assisted reproductive technology. Assisted reproductive technology is the technology used to achieve pregnancy in procedures such as fertility medication to stimulate ovulation, surgical procedures, artificial insemination, in vitro fertilization, and surrogacy. These options are available for people who are experiencing infertility or cannot conceive children naturally, which includes single parents and same-sex couples. Intrauterine insemination, IUI, as a type of artificial insemination, involves the placement of sperm directly into the uterus at the time of ovulation, either in a natural menstrual cycle or following ovarian stimulation. In vitro fertilization, IVF. IVF generally starts with stimulating the ovaries to increase egg production. Most fertility medications are agents that stimulate the development of follicles in the ovary. Examples are gonadotropins and gonadotropin-releasing hormones. After stimulation, the physician surgically extracts one or more eggs from the ovary and unites them with sperm in a laboratory setting, with the intent of producing one or more embryos. Fertilization takes place outside the body, and the fertilized egg is reinserted into the woman's reproductive tract in a procedure called embryo transfer. Donor gametes and embryos. People can also use sperm, ova, eggs, and embryos from donors in conjunction with assisted reproductive technology. These donations take place through agencies and donor banks or between private individuals. In the U.S., donors can be compensated for their donations. Surrogacy. In surrogacy, one woman, surrogate mother, carries a child for another person or persons, the commissioning person or couple, based on a legal agreement before conception, requiring the child to be relinquished to the commissioning person or couple following birth. There are different types of surrogacy which relate to whether or not the ova used to conceive the child are her own, traditional surrogacy, or not, gestational surrogacy. Adoption. People can also choose to pursue adoption to build their families with or without experiencing infertility. Adoption can take place through the foster care system, privately, or through agencies. Adoptions can be domestic, within the U.S., or international, and they can be open, with different amounts of contact between biological birth families and adoptive families, or closed.